Well, behavioral programs help kids that need 24-hour care. A lot of our kids have some real disruptive behaviors at home that affect the family and themselves and just functioning. So our behavioral units have them with us for the duration of their stay. So we're going to be able to help them with things that they just struggle on a day-to-day basis. Behavioral disorders in children are a real concern for parents. The concern is this a phase, or is this something that a kid is really struggling and may never really fully overcome? So our kids have issues with ADHD, ADD, mood disorders, autism. So it significantly impacts their life. These conditions may cause a lot of difficulty with focusing, with defiant behaviors, with intense anxiety, or even safety. Early intervention programs are critical for managing the behavioral disorders that kids have. It addresses the issue early, it identifies their struggles, and even we do additional testing with kids. They use some techniques that reinforce the positive behaviors and then skills development. Kids need to develop skills that they can develop here, but also take with them when they go home and function in the community. We want to help these kids develop their full potential. We use various strategies to help kids in developing skills. We use positive reinforcement. We use challenging scenarios that help them work through situations that normally they sort of give up, and they don't know how to continue through difficult scenarios. We encourage them to develop identification of triggers and of strategies that will help them whenever they normally struggle. Our programs really help the family come to a place where we restore some of their relationships. So in our care, we do family sessions every single week because we're trying to restore that relationship. Our kids' individual treatment plan consists of starting with an evaluation before they even come in. The families will call and do an intake screening with the staff, and then if the kid is appropriate for our care, they'll come in for services, and therapist starts to meet with the family on the first day. Our parents are very involved in the client's care. We want them doing a family session each week. We also want the kids to have passes and engagement with the parents throughout the course of their care here. That starts with the parent coming on site to do a visit. And then also that next is the level of having the kid go on outside passes with the parents to see if we've been able to restore some of the relationship issues that they've had. Most of our kids that come to us have kind of fallen behind developmentally. They've fallen behind socially, they've fallen behind academically. In an environment like this, it is intense. So they do make a lot of strides to catch up. The long-term impact is a kid going through a program like this sets them up for success later.